In this video, we will discuss about stages of labor. When we talk about stages of labor, we can divide labor into three stages. First stage, second stage, third stage. First stage is contractions. Contractions, pain, waves, we can call it in any way. Second stage is pushing. Third stage is delivery of placenta. Of course, we can also write fourth stage as breastfeeding. Contraction phase is again divided into early labor, active labor, transition. So when we talk about labor, we will talk like early labor, active labor, transition, pushing, delivery of placenta and breastfeeding. Your doctor keeps using these words. Now we will look into each of these stages. Early labor. Early labor means, as we discussed in one of the video, when you get contractions or pains or menstrual cramps after taking shower and then doing some activity, if the contractions are still there, that indicates it is true labor. If the contraction goes away, that indicates practice labor. Once you decide it's a true labor contraction, and when the contractions are 15 to 20 minutes apart and 30 to 45 seconds, that indicates you are in early labor. As the labor is progressing, when the contractions become 3 to 5 minutes apart and 1 minute long, that indicates active labor. When the contractions become 2 to 3 minutes apart and 1.5 minute long, that indicates transition. This is how the labor will progress. Initially, the contractions are very small and mild in intensity. As the labor is progressing, the contraction come closer and they become moderate in intensity. And as the labor is progressing, in transition, the contraction comes very close by, 1.5 minutes, and the rest is also only 2 to 3 minutes. By the time you finish the next contraction, the other contraction would start. So 2 to 3 minutes, and that too for 1.5 minutes, and contraction is also severe. That's how the labor will progress. Mild, moderate, and severe. So initially every 15 minutes or 20 minutes you get a contraction. So this is contraction and this is rest period. Contraction and rest period. So in early labor, the contraction is only for, the duration of the contraction is only 30 to 45 seconds, and you will have a gap of 15 to 20 minutes. Then again for 30 to 45 seconds you get a contraction. That's how the labor is progressed. The pain is intermittent, it is not continuous. When we say active labor, so you get a contraction for 1 minute and you will have gap for 3 to 5 minutes. And after 3 to 5 minutes, again you get a 1 minute long contraction. Same goes with the transition. So 1.5 minutes, but the gap is only 2 to rest. Rest is only 2 to 3 minutes. That's why this is the hardest phase. So because the contractions are very strong and the rest is also very less. So strong, intense phase. So this is the time where most of the mothers give up. They feel like they can't do it. They feel like their body is breaking into pieces. They would ask for more support in this phase. So because the body is working very hard, mothers may have, along with the pain, they may also have nausea, vomiting, chills, shivering, sweating. You can see all of this during the labor, and all these are common because of the changes because of the labor process. The first stage of labor, this contraction phase, all these contractions are to open out the cervix to 10 centimeters. That is, open out, dilate the cervix to 10 centimeters and then efface the cervix. and also to bring the baby out. The uterine fibers, one fiber would contract and another type of fibers would relax so that the baby comes down into the birth canal. This is uterus, this is cervix, this is vagina. This cervix is closed with a mucus plug. It is closed with a mucus plug all through the pregnancy to avoid infections, to keep the baby safe. The cervix is closed. With contraction during the labor, the cervix starts opening out. Of course, for some mothers, the cervix opens out to 2 to 3 centimeters in the last weeks itself, but most of the time it starts opening out with contractions. By the time the mother is in active labor, the cervix will open to 5 centimeters. And from active to transition, the cervix opens to 10 centimeters. This is how the cervix looks like. This is uterus. The thick part is cervix. It is long and thick initially during the starting of labor. As the labor is progressing, it is opening out, dilating, cervical dilation. It opens out and thins out. This thinning is effacement. For the mother to push her baby out, the cervix should be 10 centimeters dilated and 100% effaced. Then the mother can push the baby out. So it has to open out from here till here. That's why labor takes time. Why it takes so many hours for the baby to come out? Because it has to open out the cervix. The cervix is thick like this. If you touch the tip of the nose, it is thick like this. It has to become to soft like a lips. So that's why labor takes time. Each and every contraction during the labor helps to open out the cervix. So initially it is like this. So this is as the labor is progressing. This is how the cervix changes and dilates to 10 centimeters and thins out. This is how the cervix changes during the labor. So when the doctor does a cervical check, they will check the dilation and the effacement. Whether the mother is 5 centimeters or 6 centimeters dilated, how much the cervix is effaced, and also the station of the baby, how long the baby has come down. The first stage of labor is about bringing the baby down and opening the cervix to 10 centimeters and dilating, effacing to 100%. Once the mother is 10 centimeters, she feels the urge to push the baby out. She feels like passing stools. She feels like passing constipated stools. In pushing, the contractions are again the little spaced out. When we see transition, they are 2 to 3 minutes apart. Okay, so little closer. But when it comes to pushing, they are little spaced out to 3 to 5 minutes apart and 1 minute long. In this 1 minute long contraction, you have to push your baby out. Whenever there is contraction, you should push. Whenever there is rest of 3 to 5 minutes apart, you should rest. So that's how you need to do your pushing. So in that 1 minute long contraction, you can push 3 to 4 times. Okay, you can push while breathing out, which is most of them are comfortable with. But some 1 or 2% of mothers are comfortable pushing, holding their breath. So if you feel like pushing with holding your breath, make sure during your rest period, you take nice deep breath so that you get good oxygen to your baby. And most of them think contraction is hardest phase because you feel so much of pain. You feel this is the hardest phase and pushing is easy. But pushing is also equally challenging. So each stage is equally challenging. You need to focus on the contraction so that you can cope up with the contractions. So while you are pushing the baby out, so it's a big baby and small passage. The birth canal stretches. It stretches so long that sometimes you feel sensations like ring of fire sensation, you feel like burning sensation, you feel like pins and needle sensation. So all those sensations are normal during your pushing because your vaginal wall, your birth canal is stretching to almost more than 100% of its original elasticity. So first stage of labor is to open out the cervix and bring the baby down, and second stage of labor you will push the baby from this birth canal into this world. That's how the labor would progress. In pushing, uterus is contracting, the baby is also taking moves to come out, and the mother is also pushing. So it's the uterus, baby and the mother. Three of them are working together to bring the baby out. Once the baby is out, mother will also have some contractions. She'll also have some pushing contractions. You might be thinking, once the baby is out, nothing else to be done. But you also have to do some hard work because to push the placenta out. It may take any time from 15 minutes to 30 minutes for the placenta to come out. So once you push your baby out, keep the baby skin to skin contact. And that helps with initiation of breastfeeding. So if we take all the stages of labor, how much time will it take for all these stages? It may take 10 hours. The whole labor process may take 10 hours. The whole labor process may take 18 hours. Or the whole labor process may take 24 hours. It varies from mother to mother. Like we have unique thumbprint, right? Same way, labor is unique. Pregnancies are unique, labors are unique. It depends on the mother. Some mothers will have shorter labor and some mothers will have longer labors. Okay, and during this labor, when you get this pain, contractions, how you can cope up with it? There are many comfort measures that can be used to cope up with the pain. You can use hot water bag, you can take shower, there are breathing techniques, positions, massages, affirmations, music, meditation, there are chanting. All those things can be used during the labor to cope up with the pain. In the next video, we will talk about comfort measures that can be used during your labor so that it will be helpful in easing your labor pain.